Ladies and gentlemen, good morning. My name is Jacob Maycover, and today you're going to be learning about first aid utilizing the March assessment. The March assessment is backed by the DoD as well as many other first responder organizations throughout America. So, someone in the audience, can anyone tell me what any of these stand for? No? Okay. So, we're going to get down to it. I'm going to need one patient from the audience. Does anyone want to volunteer?
Sure.
All right. Go ahead and lay down for me. So, the first thing you want to do when you have an injured patient is visually and verbally assess what is wrong with them. If you can visually see the injury off the bat, then you can move forward with that. If you can't see it, let's say something's wrong under clothing, under pants, under boots, you're going to verbally ask, what's wrong, what's going on? He will respond with, whatever, leg hurts, right arm hurts, whatnot. So, something about the March assessment. It's set up in order to efficiently save life based off of what will kill you the fastest. So with M, I'm going to stand over you here. So that's a little small to see, but M is massive hemorrhaging. Massive hemorrhaging is a bleed that will not stop itself without the aid of a tourniquet or an H bandage. The only tool for the job to stop massive hemorrhaging is a tourniquet. What we have here are two Cat 2 type tourniquets. This is the preferred method to use to stop a massive bleed. I'm going to pass this one around so you can see it. Now, in absence of a tourniquet, the only other substitute is pressure. You can use a belt, anything to tie off. You can use a shirt. What you're trying to accomplish is closing the artery where that blood is coming from. So if he has a laceration to his leg that is deep enough to cause an arterial bleed, you're going to use pressure with your knee, and you're going to come in to the groin and close that artery off. You got to put a lot of pressure. It's going to cause pain. Now the patient is most likely going to come up and try to fight you off him or her. You're going to have to, utilizing the aid of somewhere else or yourself, keep them down. Now, I'm not going to put pressure right now for the demonstration because it does cause bruising and injury. Now, a little something about the tourniquet. This strap has Velcro. It can only go on one way. This is a windlass. This adds tension. This little clip here, this is a Cat 2 type, so it has two clips. You're going to want to run it through the top one and back down. I'm going to demonstrate this. So now you're doing this while applying pressure, but I'm not going to. Now, let's say this bleed is down low. That doesn't constitute you applying a tourniquet right above the bleed. The tourniquet goes as high as possible. So you're going to wind that up, come through the top loop, and what I use is a ratchet strap method. I grab the windlass with my dominant hand, I grab the strap with my dominant hand. I grab the back side of the strap and I cinch it tight. It just adds a little tension before you start using the windlass. Now once you get to here, you're going to start tightening the windlass until the bleeding stops. Not when he's feeling pain, not when you don't think he can go anymore. You tighten that until the bleeding stops. So we're going to back this off because it will cause blood clots. So the tourniquet's on. Is that too tight?
No, it's good.
Okay, so tourniquet's on, bleeding is stopped. You have now eliminated the first life-threatening injury. Airway. So you can actually do airway while treating a massive hemorrhage. What What do you think the easiest way to assess someone's airway is?
Go listen.
Yes. Yes and no. You talk to him. So as soon as I come up on this casualty and I ask him, hey man, what's going on?
I'm bleeding.
So he can talk. If you can talk, you can breathe. That's your first assessment, but that's not gold. So I just put the tourniquet on, eliminating a massive hemorrhage. I now want to, hey man, you having trouble bleeding?
No, I'm good.
No? Good?
Yeah.
Feel good? Now you want to look for equal rise and fall of the chest during this stage. You don't want them to have an internal bleed while you're going through the rest of these steps and have their airway closed. So, another thing is you're not chewing on anything, are you?
No.
Nothing in your mouth?
No.
Okay. Because if they go unconscious, they're going to choke on it. So, airway's good. Now, another thing. If they do go unconscious, at any point in time during this assessment, you take your knuckles on their sternum and you rub. You rub hard and you get them awake. An unconscious patient is hard to assess. You can't see pain, you can't see visuals, and you can't assess airway. So, you sternum rub, get them back awake. Stay with me. So, respiratory. Okay, you've now eliminated two of the biggest things that cause death at the scene of injury: massive hemorrhaging and airway. Those are the two top ones. Respiratory, you're looking for less life-threatening bleeds. So what you're going to do is start with big pipes, little pipes. Big pipes are legs. I already put a tourniquet on here, so I'm going to immediately go back and reassess. Okay, that's not bleeding, so I don't need to worry about this leg. I'm going to sweep my hand down the top portion of his legs, looking for any more blood, any more lacerations, injuries like that. I'm going to come up to his arms. I'm going to sweep again. I got no blood. Now, you do that for two reasons. You run your hands through so that you can find an injury, but you also do that so if you have to do this in the dark, you can feel blood. Blood will coagulate on your hands as you swipe. Because if you're doing this in the dark, you may not be able to see an injury. So, he has no further injuries. We're going to move on to circulatory. So, now you're going to assess his heart rate, his pulse. So, what you're going to do is you're going to find a pulse on both arms. Once you get that pulse, you're going to count how many beats he has in 15 seconds. You're going to take that number and you're going to times it by 4. That will give you what?
How many in a minute?
Beats per minute. And time is of the essence here, so we use 15 seconds times 4 to average it out. So you get that number and you jot it down. You jot it down mentally or write it down if you have that ability. You do that for two reasons. This patient is your responsibility until he is to the next echelon of care. The next echelon of care is a paramedic or a first responder. And everything you do to this patient needs to be passed on to that first responder, so that time isn't wasted reassessing injuries that have already been addressed, especially if it's an extremely life-threatening situation. So, I got his pulse. I'm now going to double back and look for any last minor injuries that I need to assess. So now we're doing little pipes. So I'm going to go down his arm and I'm going to wash rag to feel for broken bones, any minor cuts. Go ahead and squeeze my hand. Okay, that hurt?
Nope.
Nope. Okay. Same thing here. Any broken bones? That looks good. Squeeze my hand. Does that hurt?
Nope.
Okay. Same thing with the legs. Any of that hurt?
No, good.
Go ahead and push against my hand. Okay, pull back. Any of that hurt?
No.
Okay. Same thing here. Go ahead and push against my hand.
I can't feel my feet.
Oh, see? So now you need to address this injury here. So you're gonna remove clothing until you find the injury, and you can address this. Let's say it's a laceration here. Another thing you should keep with your first aid kit, combat gauze, or any other dressing that can prevent bleeding or infection. So we find that minor injury, and you're going to dress it here to fight off infection. So once we've addressed that, we're going to move on to head and hypothermia. Now, this is extremely important because any accident, shock is one of the biggest things that a patient will enter. And when you're in shock, you do irrational things. So, when you move to the head, what you're looking for is any cuts, bruises, any sign that he had a head injury. Head injury can cause brain bleeds, which can't be visible to your eye, but are extremely life-threatening. So you're going to look for fluid leaking out of the ears. That's a big cause, or that's a big sign and symptom of a head injury and a spinal injury. So if you don't see any cuts on the head, anything like that, you're going to check for pearla. Pearla is pupils equal, round, and reacting to light and accommodating. All that means is your pupils are dilated. So you're going to check that. Go ahead and close your right eye. Keep that eye open. You're going to give it a little time. Okay, open this eye. So what I just did is I checked his pupil to see if it would dilate when light was applied, and it did. You do that to the same eye, and if they're dilating, that means he's okay. But a head injury doesn't necessarily always show these signs and symptoms. So depending on what the accident is, you can pass to the next echelon of care that, hey, he may have hit his head, especially if he's going into shock. Now, keeping the patient warm is a big thing, especially with shock. So if you can find something to cover him up, get him off the ground, like we are here, we're on this mat, that keeps them up off the ground and allows them to retain their body heat. Now, once you do all these steps, you rinse and repeat. You double back, you start again. You start looking for another massive hemorrhage. You reassess this tourniquet, you tighten it back up if you need to. And you do that until who comes?
Next line of care.
The next line of care, a higher echelon of care that can take that responsibility off your hands. So, go ahead and have a seat for me. Thank you for being my patient. So, today, you've learned the March assessment. I didn't write head and hypothermia there, but so if at any point in time you guys have a question, feel free to contact me, myself, or your local first responder. He will be more than happy to go back through this assessment with you. And do I have any questions at this time?
Nope.
All right, great.